My name is Calvin Pugh, and I'm the Senior Advisor on Community Engagement at IAPAC, and this is COVID, HIV, and me, COVID-19 Mitigation Measures. Upon successful completion of this activity, learners will be able to understand basic facts about COVID-19 and how it spreads, define prevention and mitigation in the context of COVID-19, and describe personal mitigation and prevention measures to minimize dramatic health consequences caused by COVID-19. Let's start with the basics. What is COVID-19 and how does it spread? Coronaviruses are a type of virus. There are many different kinds and some cause disease. A coronavirus identified in 2019, SARS-CoV-2, has caused a pandemic of respiratory illness called COVID-19. SARS-CoV-2 may have originated in an animal and changed or mutated so it can cause illness in humans. COVID-19 can be severe and has caused millions of deaths around the world, as well as lasting health problems in some who survive the illness. COVID-19 is spread through droplets and virus particles released into the air when an infected person breathes, talks, laughs, sings, coughs, or sneezes. Symptoms show in people within 2 to 14 days of exposure to the virus. And a person infected with COVID-19 is contagious to others for up to 2 days before symptoms appear, and they remain contagious to others 10 to 20 days, depending on their immune system and the severity of their illness. Now, COVID-19 symptoms can include fever, chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, or diarrhea. Prevention and mitigation measures are key to public health interventions to minimize severe health problems caused by COVID-19. Prevention measures aim to minimize the risk of transmission from infected to non-infected individuals in order to stop the outbreak. Mitigation strategies aim to slow the disease and reduce peaks in healthcare demand. Now, there are 7 ways to protect yourself. That is testing, vaccination, covering your nose and mouth when you cough, washing your hands, masks, and cleaning surfaces. Personal prevention measures should include washing your hands frequently, maintaining social distancing, avoiding touching the face, covering your cough or sneezes to protect others, and seeking medical advice when necessary if you need to be seen by a provider, and to stay home away from others and stay informed of current outbreaks. The other thing is to get vaccinated. COVID-19 vaccines are effective at preventing you from getting sick. The vaccines are highly effective in preventing severe illness, hospitalizations, and death. Getting vaccinated is the best way to slow the spread of SARS-CoV-2, the virus that causes COVID-19. And the CDC recommends that everyone who is eligible stay up to date on their COVID-19 vaccines, including people with weakened immune systems. It's important to cover your cough. So to cover your mouth or nose with a tissue when you cough or sneeze, or cover your mouth or nose using the upper sleeve, not your hands, when you cough or sneeze. Ensure that you put the used tissue in a wastebasket. Wash your hands with soap and water, or clean your hands with alcohol-based hand rub or gel if soap and water are not readily available. Continuing on hand hygiene, you need to wash your hands often with soap and water for at least 20 seconds, especially after you have been in a public place or after blowing your nose, coughing, or sneezing. Fully dry your hands with a towel when you're done. And if soap and water aren't readily available, use a hand sanitizer that contains at least 60% alcohol, and avoid touching your eyes, nose, and mouth with unwashed hands. Now, there are 2 different kinds of tests that you can choose when testing for COVID-19, when you're self-testing. Regardless of the test type you select, a positive test result means that you have an active infection and should isolate and inform your close contacts to avoid spreading the disease to others. Over-the-counter self-tests are viral tests that can be used at home or anywhere, are easy to use, and produce rapid results. Anyone can use self-tests, regardless of their vaccination status or regardless of whether they have symptoms or not. And in summary, a coronavirus identified in 2019, SARS-CoV-2, has caused a pandemic of respiratory illness called COVID-19. COVID-19 is spread through droplets and virus particles released into the air when an infected person breathes, talks, laughs, sings, coughs, or sneezes. Prevention and mitigation measures are key to public health interventions to minimize the dramatic health consequences caused by COVID-19. The 7 most important and effective measures you can take to protect yourself from others from COVID-19 include vaccination, physical distancing, respiratory etiquette, hand hygiene, wearing a mask, self-testing, and cleaning and disinfection. And here are some additional resources to find out more.